educate them about the importance of having smoke-free policies in your home. So I'm just here today, and I'm just so pleased that we're together. They're in shrinking resources. Many times party populations are kind of pitted at each other to compete for those resources, but part of what we're doing is saying that we can stand together, that we have many of the same issues, and that we're stronger, united together, dealing individually with our issues and collectively as well. In our African American component of this, we're going to be particularly focusing on our African American men who have such high rates of smoking and lung cancer, and we're also going to be dealing with the whole issue of how regressive taxes are unfair to African Americans, because they're progressive taxes and they help our community to stop smoking, and that's what we need. Thank you for your attention. And I'm going to bring up after me Bob Gordon, who is with CLASH, the Coalition of Lavender-Americans on Smoking and Health.
Thank you, Carol, and welcome again, everybody. So, we're here to say that the needs in our community are terribly urgent, and yet those needs often seem to be left waiting. Now, despite the situation of certain communities being left behind, there are inspiring examples, many inspiring examples that exist of what we can achieve when we come together. And policies and programming that's initiated by our communities and for our communities can indeed be powerful. Now, we should always remember the Uptown Coalition from 1989 that pushed back against R.J. Reynolds when it tried to foist its Uptown cigarette brand on Philadelphia's African American community. The Uptown Coalition pushed back, and they drove the marketers of this was-to-be new brand out of town. And some more current examples of our programmatic success include grassroots efforts in the LGBT community to ask elected officials to sign a statement that they won't take money from the tobacco industry when they run for office. And 40 California lesbian and gay elected officials have already joined this Clean Money campaign, united in health, and they serve as role models for our community. Now, also nationwide, thanks to advocates working with the Department of Housing and Urban Development, over 200 public housing authorities in 27 states have a smoke-free policy. So more people who live in low-income housing receive some protection from exposure to secondhand smoke in their homes. And last but certainly not least, health advocates in Guam made their tobacco tax one of the highest in the United States. This type of public health policy can help discourage, for example, Pacific Islander youth from taking up smoking in the first place, while encouraging adults on the island to make more quit attempts. Now contrast that with California, which does not have one of the highest tobacco taxes in the United States. In fact, it's 87 cents per pack. It's only 2 cents higher than the smoky state of Nevada. And what does this mean for California? It means missed opportunities to reduce cancer and all tobacco-related disease in our state. It means a missed opportunity to save more lives. Yes, the needs of our communities are daunting, but we can come together, as we are today, to fight on behalf of the most vulnerable among us. And now we'd like to bring up Claradina Soto with USC, who will facilitate our question and answer period. Thank you.
Thank you, Rod, Lourdes, Lisa, and Carol and Bob for your very important words. It's very important that we stay united against commercial tobacco abuse. So at this time, I'd like to ask if there are any questions for any of our speakers. Yes.
Hi, I am Pat Edom, and I'm a resident of Long Beach, and I've long been involved in tobacco control and prevention. And I actually have a question for Carol, and regarding the prevalence in the African American male population, is it also somewhat related to military duty and service, do you think? Or is this something that perhaps the data, once disseminated, more research,
Right. I'm not really sure about the military issues. I know during World War II and also the Vietnam War, I believe that our military were given free cigarettes, and that there was a big, huge increase overall for all military people after World War II. But I'm not so sure that the current high prevalence of smoking for African American men is related to military use.
there really evidence that higher taxes on cigarettes decreases use of cigarettes?
Yes, thank you. There are boxes of research that show that higher taxes prevent youth from taking up smoking. I believe the figures, and we can certainly check on this, about 7% of youth, with a 10% increase on a tax, there are 7% fewer youth taking up smoking. And as you know, tobacco taxes have been around for a long time, and what that means is there's plenty of research about what tobacco taxes do. Not only stopping smoking, and I actually, in San Francisco, where we help lesbian, gay, bisexual, transgender people quit smoking, who are ready to quit smoking, we hear anecdotally, after every tax attempt, or even every news article that talks about taxes, and people say, you know, I was gonna quit when the price of cigarettes was, you know, $1, and now it's, you know, $6. And I said, and I hear the taxes going up, I gotta quit. I'm making the choice between, you know, one student, she's actually at San Francisco State University, making a choice between, you know, was she gonna buy groceries that week, or was she gonna buy another carton? And save lives, save money. When we ask you, what are you gonna do with the money that you save, the time that you save when you're smoke-free? What are you gonna do with all your energy? So that's why we're, you know, putting our energy for any policies, any attempt to save lives. That's really what this is about. We have family members who have suffered. We have community members, friends. So 450,000 approximately tobacco-related disease deaths in the United States every single year. And we have to use every policy that we can to make sure that you know, that we decrease cancer, heart disease, lung disease, all the tobacco-related illnesses.
What do you find then among these people you talk to, and whether it's statistical or just anecdotal, what's the thing that leads them to cigarettes in the first place? Is it the general being cool, or is it, do they say to you, oh, it's because of these ads we see in the magazines? Or?
Yes, it's really, it's a multifaceted problem, but a lot of it has to do with the tobacco industry targeting. Right now in the news, we're talking, the FDA is debating whether they're going to regulate menthol and take menthol out of cigarettes. And so we can document that between, in the 60s and 70s, the tobacco industry really heavily marketed menthol cigarettes to African Americans and really doubled the smoking prevalence, so that the vast majority today of African Americans who smoke mentholated cigarettes, over 80% and 90% of the youth. So it's complex. It has to do with the norms in the community, in the African American community. You can buy loose cigarettes. There's a norm that things are just kind of accepted. So when you begin to change those community norms, every communities respond, but it's just our communities, those things change a lot slower. And sometimes problems seem to be intractable, and really by the proper attention can change things. But a lot of it has to do with the tobacco industry targeting communities, and also aligning with our community, our leaders and our community-based organizations. The tobacco industry has sponsored many groups and advised us silence. So when I go out and speak to African Americans about this is our #1 killer, and this is part of this project, is just getting out the information that exists that our people are not really aware of. So many people are still surprised today that that's our #1 preventable cause of death, and that kills more than all of the other things that we think are problems combined: violence, AIDS, car accidents. Tobacco kills more people than all of those things combined, but we don't put the resources there that we need to address it, to deal with it as a priority issue, as important as anything else that's facing our community.
Hi, yes, this is a timely time to be really announcing appeals efforts. I know that the State Tobacco Education and Research Oversight Committee is currently working on the master plan for the next 3 years for California. And so for appeal as a group, are there maybe, I don't know from each of you, but is there a certain initiative that you would be promoting that would help communities interpret the data that you will be disseminating? I think that that's, you know, really something that's key, that providing data is one thing, but getting people to understand and then become empowered to act upon the data is another thing. So.
And just to clarify, the project is ADEPT, and APEAL is one of 5 organizations that are involved. But one of the main reasons for doing this project is to be able to synthesize and translate data that does exist for both our communities and the general public, so that we can convey the seriousness of tobacco and be able to work towards the implementation of effective programs and policy initiatives. So that is one of the goals of that.
Any more questions? Well, I'd like to thank everybody for coming today and supporting our efforts, and thank you speakers once again. So we'll be available for questions individually or as a group.
I want to add one thing about this collaborative. One of the things that we're looking to really relaunch self-determination in our communities with regards to tobacco control. And that we, in this room, we have a collective of years of, 150 years. And so we have a lot of knowledge that with, inflation, with the original tax from Proposition 99 and decrease in funding, smokers dying, smokers quitting, there's just been a reduced funding amount in order to do the work that needs to be done. So we really want to reinvigorate our own communities, that this is a serious issue, to help them, empower them to advocate for the things that their community needs. And we also hope to provide guidance and the leadership with our Department of Public Health about what our communities need going forward too, so that we are not left behind and that we can benefit from the gains from the mainstream of Californians.
I just want to add to that, we have invited many of our coalitions in the Southern California area, but also in Northern California, which we're hoping will also be part of that dissemination process. Because we know you have very strong coalitions. We have the Long Beach Coalition here as well, Pasadena and LA, and others up north and in the south. And so we're hoping that you will join us in that dissemination of information that's very empowering in our communities as well. And I just wanted to add to that, in addition, the time that it takes from discovery to delivery of information for public health initiatives is an average of 8 years. We don't have that kind of time to waste in our communities before getting the information out. And so this collaboratively is really the intent, is to get that information and hasten that speed by which we can get our communities